with ivermectin paste, the horse paste, the $8-9 horse paste that, you get at whatever, veterinary supply. And I've had patients I had one patient, for example, who was putting ivermectin on a tongue cancer, and she could actually feel the lesion start. And it was her doctor who actually wrote to me and said, this patient, she feels her lesion shrinking because she could feel it in her mouth because the lesion was on the tongue. She could feel it every day. After a few weeks, the lesion she could feel it shrinking. You could apply it to breast lumps, and women have reported to me breast lumps shrinking. Even benign lesions like lipomas or all kinds of cysts, just apply the ivermectin paste and you can see these things shrinking as the ivermectin gets absorbed through the skin. So, the topical ivermectin is a wonderful thing. Get some horse paste, stock up on it, get like 10 tubes. You can literally get the 1% ivermectin cream from India Mart for $2. $2 US. I ordered 30 of them at a time just to make the shipping worth it from India. But it's an incredible thing. And you can, if you get a bunch of tubes, you could give it to your neighbors, you could give it to your loved ones. It's simple. It's simple, and the family doctors are afraid of it. They assume fetal position when you talk to them about this. Seriously. And so, now switching to oral ivermectin, certain autoimmune conditions respond to ivermectin. And the ones that I've seen, rheumatoid arthritis will respond to ivermectin. Juvenile rheumatoid arthritis. I've got juvenile rheumatoid arthritis patients. I have a ballerina, a 16-year-old ballerina who had spondylitis that responded to ivermectin. And she had really trouble with movement and this constant inflammation and so on. So when you've got inflammatory conditions, think ivermectin, low dose, 12 milligrams, 24 milligrams, and it may respond. Another area that very few people know about is ivermectin has effect on neurological conditions. And the ones that I've had the most success with have been Parkinson's and Alzheimer's disease. And again, it's a very simple thing. I discovered it by accident. There was a mouse model of sort of Parkinsonism. And for Alzheimer's, you can't even find the research because it's been scrubbed from Google. So there's a study that was done, a preclinical study on ivermectin and Alzheimer's, where the researchers concluded that ivermectin has an effect on Alzheimer's and should be studied. It's been scrubbed from Google. If you go on DuckDuckGo, you can actually get the abstract of that study. But in Google, it's completely scrubbed. You just see the titles. It was done in the Middle East, and it's nowhere to be found. You can't get a PDF of the article, nothing. Completely scrubbed. Parkinson's disease, I've used high doses of ivermectin, something like 60 milligrams, 72 milligrams, and these patients are responding. They have improvement in symptoms, improvement in movement. I have a patient who was barely mobile on maximum doses of standard treatment, who after a few weeks of high dose ivermectin started playing golf. And she hadn't been able to play golf for many years. And I've seen reversal in a number of Parkinson's disease patients. Now, Alzheimer's, this is where it gets really fascinating and really blew my mind. As patients sort of started asking me, could I use it for my 90-year-old father or mother and so on. And I said, look, start with a low dose. Let's see what happens, right? Because the older you are, you might have some side effects with ivermectin. There's, if you give too high of a dose to an older person, you might get a little bit of confusion, a little bit of instability on the feet. And so start with 12 milligrams. And these, the family members are trying. And some of these patients are recognizing family members after just a couple of doses. They're recognizing family members they haven't recognized in years. Their memories are coming back. So they start reminiscing. They remember things. Their cognitive ability starts to come back. Literally just 12 milligrams, 24 milligrams of ivermectin for a few days, 4 or 5 days. Just try it. And I tell people, just try, report back to me. And I had one patient who was actually taken off hospice because they were doing so well. It's just incredible. And people tell me, you know, they get this precious time back with their loved ones. And especially with someone who's, you know, been suffering from Alzheimer's for many years, you know, you feel like you've lost your loved one, and then suddenly they're back. They say, my grandma's back. She's got her sense of humor back. Her memories are back. And this is literally with a couple of pills of ivermectin. Safe, zero risk. And the moments that the family gets back are so precious. You can't buy it. It's incredible. And so I always say, give it a shot, just give it a try, just a little bit. Patients who are sort of bedridden, not responsive, suddenly the next day they're up and about, they're eating pudding. Like, it's just unbelievable stories. And I share all these stories on Twitter. I share them on Substack, and I, you know, highly encourage you to have a look at them sometimes. So ivermectin in neurological diseases, specifically Parkinson's and Alzheimer's. But it's really the cancer is where I've been focusing a lot of my work, and most of my patients are stage 4. Unfortunately, people come to me very late. Now, when they come to me early, I'll tell you what happens. I get breast cancer patients. They'll come to me early. They come to me before surgery, and they say, look, I've got mastectomy, but it's like 3 months from now, 4 months from now. I've got a 6-centimeter tumor. I've got a 7-centimeter tumor. So I put them on ivermectin and another antiparasitic. I use 2 antiparasitics, ivermectin and fenbendazole, or ivermectin and mebendazole. Fenbendazole and mebendazole are almost identical. One is FDA approved. The other one is a dog dewormer. They are virtually identical.